Teddy Bridgewater's injury is unfortunate because it's going to take him out for this season. He dislocated his knee from what we can tell, which means the top part of the knee and the bottom part of the knee pulled apart. And if you look in there, you'll see there's a little ligament that holds the knee together. And this is called the ACL, or anterior cruciate ligament. When you pull the knee apart, well, that rubber band-like structure snaps. And that means you've got to have surgery to repair it. There are many ways of doing the operation. You can use tissue from yourself. You can use something that's been donated by cadaver. So they will repair this, I'm quite certain. The operation will probably take place in a couple days once some of the swelling's gone down. But you've got to rehab the knee, and he's only 23 years old, so you really want to let him recover fully and invest in his future. He will not be playing, I do not think, this season again, but he should be back to full speed next year. Whenever you fracture part of your spine, it's a serious injury. So for Tony Romo, this was a big deal. Just to be clear, he fractured the lumbar 1 vertebrae, which means if you have there are 5 of the vertebrae in the lumbar space, this is the first one, right? So it's sort of the middle of your back. And these injuries happen because this is your hip bone, and this is your head up here. You literally crunch the spine. So these are the little discs that sometimes people talk about hurting. That's not where the problem was. He literally crushed the front part, because as he was squeezed together and bent over during that fall, this bone crumbled. Now that means that there's potential risk, if it doesn't heal well, to the spinal column, which is back here, which is why you don't play around with this. Main thing, like you would in any kind of fracture, is to immobilize the spine, so he'll be in a bit of a brace to make sure he can't bend here too much. Tony Romo can fully recover from this injury, of that I'm sure. I know he's had past back operations, and although I'm not managing his care, I have confidence that an athlete in his condition can recover from this as long as he lets it heal adequately.